NCLEX Next Gen Sample Questions 2026 NGN Practice Test and Answers. Question 1. A baby with meningitis has a positive Kernig sign. What will cause her pain? Option A, flexing her ankle. Option B, flexing her spine or hips. Option C, bending her wrist. Option D, turning her head. The correct answer is option B, flexing her spine or hips. Irritation of the brain lining makes any stretching of the spinal cord very painful. Question 2. What is a common initial sign of meningitis in a child? Option A, constipation. Option B, low body temperature. Option C, seizures. Option D, sunken soft spots on the head. The correct answer is option C, seizures. Sudden seizures are a frequent warning sign that the brain is infected and irritated. Question 3. How can a nurse help a 6-week-old baby with meningitis feel trust? Option A, give her a soft blanket. Option B, clean her skin frequently. Option C, leave the door open. Option D, pick her up and comfort her when she cries. The correct answer is option D, pick her up and comfort her when she cries. Fostering trust in an infant requires being responsive to their needs and providing physical comfort. Question 4. What should a nurse tell a mother who wants to give aspirin to her daughter for chickenpox? Option A, do not give her any aspirin. Option B, check her for allergies first. Option C, listen for ringing in her ears. Option D, only give one tablet. The correct answer is option A, do not give her any aspirin. Aspirin can lead to Reye syndrome, which is a fatal condition for children with viral infections. Question 5. Which play activity is best for a 2-year-old recovering from surgery? Option A, a large piece puzzle. Option B, a wheelchair ride. Option C, listening to a story. Option D, watching television. The correct answer is option A, a large piece puzzle. Toddlers are in a stage where they want to do things themselves, so a puzzle helps them feel independent. Question 6. A boy with a head injury has a temperature of 102. What should the nurse do? Option A, check the blood pressure again. Option B, give Tylenol and wait. Option C, wait an hour and recheck. Option D, call the physician immediately. The correct answer is option D, call the physician immediately. A high fever after a head injury is a major concern that requires immediate medical attention. Question 7. What is a common source of lead poisoning for children? Option A, dandelion leaves. Option B, pencils. Option C, old paint from houses built before 1960. Option D, stuffing from toy animals. The correct answer is option C, old paint from houses built before 1960. Children often chew on windowsills or eat paint chips that contain lead, which is toxic to the brain. Question 8. How can a nurse help a woman with multiple sclerosis who has double vision? Option A, tell her to stop focusing on close objects. Option B, tell her to take more naps. Option C, give her artificial tears. Option D, have her wear a patch over one eye. The correct answer is option D, have her wear a patch over one eye. An eye patch stops the brain from seeing 2 images at once and is a simple way to manage the symptom. Question 9. What is a key fact about the course of multiple sclerosis? Option A, it gets worse every day without stopping. Option B, it has unpredictable periods where it gets worse and then gets better. Option C, it is rapidly fatal. Option D, it is cured by antibiotics. The correct answer is option B, it has unpredictable periods where it gets worse and then gets better. Multiple sclerosis is characterized by flare-ups and remissions that are hard to predict. Question 10. Why are pain relievers often avoided after a head injury? Option A, they make antibiotics less effective. Option B, they raise the blood pressure. Option C, they hide the symptoms of increasing brain pressure. Option D, they overstimulate the brain. The correct answer is option C, they hide the symptoms of increasing brain pressure. It is critical to be able to monitor the client's level of consciousness without the influence of sedating drugs. Question 11. How can a mother prevent the spread of her baby's meningitis? Option A, avoid touching the baby. Option B, stay outside the room. Option C, wear a gown and gloves and wash her hands. Option D, wear a mask at all times. The correct answer is option C, wear a gown and gloves and wash her hands. Following strict hygiene and using protective clothing helps keep the bacteria from spreading to others. Question 12. What must a nurse ask before a client has a magnetic resonance imaging scan? Option A. Do you have an allergy to seafood? Option B. Do you have a history of seizures? Option C. Do you have any movable metal implants like a pacemaker? Option D. Do you have any pins or screws in your bones? The correct answer is option C. Do you have any movable metal implants like a pacemaker? The powerful magnets in the machine can pull on metal inside the body, causing severe internal injury. Question 13. How can a nurse help a child with meningitis who is sensitive to light? Option A. Turn off the lights or dim them. Option B. Have her breathe deeply. Option C. Offer warm liquids. Option D. Give her a large pillow. The correct answer is option A. Turn off the lights or dim them. Light sensitivity is very common and painful in meningitis, so keeping the room dark provides comfort. Question 14. A client says the CIA replaced his girlfriend with a twin. This is A. Option A. Grandiose delusion. Option B. Paranoid delusion. Option C. Auditory hallucination. Option D. Visual hallucination. The correct answer is option B. Paranoid delusion. This is a false belief based on suspicion and the idea that someone is being persecuted or tricked. Question 15. What is the highest priority for a client who hears voices telling him to kill his girlfriend? Option A. The hallucinations themselves. Option B. The paranoid delusions. Option C. The potential for violence toward others. Option D. His communication problems. The correct answer is option C. The potential for violence toward others. Safety is always the first priority. The nurse must act to prevent the client from acting on the command hallucinations. Question 16. How should a nurse respond to a client who hears voices that are not there? Option A. I understand they are real to you but I do not hear them. Option B. Just ignore them and they will go away. Option C. You cannot leave because the door is locked. Option D. We will have to put you in a padded room if you say that. The correct answer is option A. I understand they are real to you but I do not hear them. This acknowledges the client's experience without validating the hallucination as reality. Question 17. Why is haloperidol often given to a violent or agitated client? Option A. It makes them think the staff is helping. Option B. It is used to put them to sleep. Option C. It is a minor tranquilizer. Option D. It is a fast way to stabilize their behavior and thoughts. The correct answer is option D. It is a fast way to stabilize their behavior and thoughts. This medication works quickly to calm a client and help them return to reality-based thinking. Question 18. A client has a stiff neck and cannot sit still after taking haloperidol. What is this? Option A. Parkinsonism and muscle spasms. Option B. Dystonia and restlessness. Option C. Restlessness and tremors. Option D. Brain swelling. The correct answer is option B. Dystonia and restlessness. These are common early side effects of the medication that can be very uncomfortable for the client. Question 19. Which drug is used to stop the stiff neck and restlessness caused by antipsychotic medication? Option A. Lorazepam. Option B. Halcion. Option C. Cogentin. Option D. Navina. The correct answer is option C. Cogentin. Cogentin is the standard treatment for blocking the muscle reactions caused by certain brain medications. Question 20. Which statement by a client shows they are ready to be discharged from a mental health unit? Option A. I will take my medicine and call my therapist if I hear voices. Option B. I will take extra medicine if I have side effects. Option C. I will stop my medicine once the voices are gone. Option D. I am going to throw away my medicine as soon as I leave. The correct answer is option A. I will take my medicine and call my therapist if I hear voices. The client shows they understand the need for ongoing treatment and know when to ask for help. Question 21. Which electrolyte imbalance is a likely cause of a client not being able to move well? Option A. High sodium. Option B. High calcium. Option C. Low potassium. Option D. High magnesium. The correct answer is option C. Low potassium. Potassium is essential for muscle function and low levels lead to severe weakness and fatigue. Question 22. What is a normal finding when listening to breath sounds over the bronchi? Option A. The inhale is longer than the exhale. Option B. The sounds are very high-pitched. Option C. The sounds are muffled. Option D. The inhale and exhale are equal in length. The correct answer is option D. The inhale and exhale are equal in length. In this area of the chest, it is normal for the two parts of the breath to sound the same. Question 23. What is a lifelong requirement for a client who had their entire stomach removed? Option A. They must drink 3 liters of water a day. Option B. They must see the doctor every 3 weeks. Option C. They must get vitamin B12 injections for life. Option D. They must eat 3 large fiber-rich meals a day. The correct answer is option C. They must get vitamin B12 injections for life. Without a stomach, the body can no longer absorb this vital vitamin from food. Question 24. Why would a nurse stop an intravenous potassium infusion? Option A. If the urine output is only 22 milliliters an hour. Option B. If the potassium level is normal. Option C. If the heart monitor looks normal. Option D. If the blood sugar is low. The correct answer is option A. If the urine output is only 22 milliliters an hour. Potassium is cleared through the kidneys, so if the client is not urinating, it can build up to a deadly level. Question 25. Which observation might show a client is becoming dependent on morphine? Option A. They ask for medicine every 4 hours. Option B. They fall asleep after the injection. Option C. They ask for medicine even when their vitals are normal. Option D. They appear very happy and euphoric for an hour after the dose. The correct answer is option D. They appear very happy and euphoric for an hour after the dose. Feeling high or euphoric is a sign that the person is using the drug for the feeling rather than just for pain relief. Question 26. A client has quiet breath sounds in the bottom of her lungs after surgery. What should the nurse do? Option A. Have her cough and take deep breaths every hour. Option B. Get a blood gas test. Option C. Increase her oxygen. Option D. Check her dressing for bleeding. The correct answer is option A. Have her cough and take deep breaths every hour. After surgery, the lungs can partially collapse, which is called atelectasis, and deep breathing helps reinflate them. Question 27. What medication might be given to a client after neck surgery if their blood pressure is 140/90? Option A. Nifedipine. Option B. Furosemide. Option C. Magnesium salicylate. Option D. Nitroglycerin. The correct answer is option A. Nifedipine. It is important to keep the blood pressure low to prevent the surgical repair in the neck from bursting or bleeding. Question 28. A client has leg pain after a knee surgery. What is the first thing the nurse should do? Option A. Check his vital signs. Option B. Elevate the leg. Option C. Check the circulation and nerves in the leg. Option D. Teach him how to use the pain pump again. The correct answer is option C. Check the circulation and nerves in the leg. The nurse must make sure the pain is not being caused by a lack of blood flow or a problem with the surgical site. Question 29. What is a primary goal for a client with Meniere's disease? Option A. Walk as much as possible. Option B. Prevent a fall or injury. Option C. Eat 3 meals a day. Option D. Prevent infection. The correct answer is option B. Prevent a fall or injury. This disease causes severe dizziness and vertigo, which makes the client very likely to fall. Question 30. What should a nurse do if a doctor orders a client with poor leg circulation to have their legs elevated on pillows? Option A. Carry out the order. Option B. Question the order because it could reduce blood flow further. Option C. Ask for an arteriogram instead. Option D. Tell the client to stop smoking. The correct answer is option B. Question the order because it could reduce blood flow further. Elevating the legs makes it harder for the heart to pump blood down to the feet, which are already struggling for circulation. Question 31. A client has a very low white blood cell count and is in isolation. What should the nurse tell a visitor? Option A. You are at risk of getting sick from the client. Option B. Hospital rules must be followed at all times. Option C. The client is at extreme risk of getting an infection from you. Option D. We are following the latest government guidelines. The correct answer is option C. The client is at extreme risk of getting an infection from you. The main goal of isolation for these clients is to protect them from any germs the visitor might be carrying. Question 32. A husband asks a nurse to save his wife even though there is a do not resuscitate order. What should the nurse do? Option A. Call the doctor to say she died. Option B. Remind him of the order. Option C. Explain why the order was written. Option D. Call a code and start CPR. The correct answer is option D. Call a code and start CPR. In an emergency, the family's immediate request overrides the written order unless there are other legal documents in place. Question 33. A visitor faints in the hallway. What should the nurse do first? Option A, sit him up and slap his face. Option B, elevate his legs. Option C, put a cool cloth on his head. Option D, put his head between his knees. The correct answer is option B, elevate his legs. Lifting the legs helps the blood flow back to the brain so the person can wake up. Question 34. When is the best time to perform a testicular self-exam? Option A, when the client first wakes up. Option B, when the person is cold. Option C, after a warm shower. Option D, when it feels painful. The correct answer is option C, after a warm shower. Warmth relaxes the scrotum and makes it much easier to feel for any abnormal lumps or changes. Question 35. A client has a very low blood pressure after taking a heart medication. Which data is most significant? Option A, his pulses are weak. Option B, he has not had enough fluids for 2 days. Option C, his potassium is low. Option D, his heart rate is fast. The correct answer is option B, he has not had enough fluids for 2 days. If a person is dehydrated, medications that open up the blood vessels will cause a dangerous drop in pressure. Question 36. What is the first thing a nurse does when a client arrives with a suspected heart attack? Option A, take their vital signs. Option B, connect them to the heart monitor. Option C, ask if they still have pain. Option D, complete the medical history. The correct answer is option B, connect them to the heart monitor. The nurse must see the heart rhythm immediately to detect any life-threatening electrical problems. Question 37. What is a common symptom of a bulge in the large abdominal artery? Option A, dull shoulder pain. Option B, numb legs. Option C, less frequent urination. Option D, many clients have no symptoms at all except for a pulsing feeling in the belly. The correct answer is option D, many clients have no symptoms at all except for a pulsing feeling in the belly. An abdominal aortic aneurysm often has no warning signs until it is ready to burst. Question 38. A client with anemia likes to eat white chalk. What should the nurse explain? Option A, it will interfere with your calcium. Option B, it will cause more cramps. Option C, it stops your body from absorbing iron. Option D, it competes with your vitamins. The correct answer is option C, it stops your body from absorbing iron. Eating substances like chalk can cause the iron in your food to become unusable by the body. Question 39. Which blood test results define aplastic anemia? Option A, a slightly low red cell count. Option B, low white cells and low red cells and low platelets. Option C, a high white cell count. Option D, high red cells but low platelets. The correct answer is option B, low white cells and low red cells and low platelets. This condition is characterized by the bone marrow failing to produce all 3 types of blood cells. Question 40. Which food is a good source of protein for a person with a deficiency? Option A, cantaloupe. Option B, rice. Option C, chicken. Option D, green beans. The correct answer is option C, chicken. Chicken is a high-quality protein that also contains the vitamins needed to help the body use that protein. Question 41. Which medication can cause a decrease in blood cell production as a side effect? Option A, prednisone. Option B, timolol. Option C, gentamicin. Option D, phenytoin. The correct answer is option D, phenytoin. Phenytoin has been linked to blood disorders where the body stops making enough new blood cells. Question 42. A client has tingling in their fingers and muscle twitching after a thyroid surgery. What should the nurse do? Option A, report it to the doctor immediately. Option B, help the client exercise. Option C, check the potassium level. Option D, give seizure medicine. The correct answer is option A, report it to the doctor immediately. These are signs that the parathyroid glands were damaged and the client has dangerously low calcium. Question 43. What is an important question for a client with a certain type of anemia caused by low folic acid? Option A, do you take aspirin? Option B, do you drink a lot of alcohol? Option C, do you eat red meat? Option D, are your stools normal? The correct answer is option B, do you drink a lot of alcohol? Alcohol abuse is one of the most common causes of folic acid deficiency in adults. Question 44. An 18-month-old has white soapy ulcers in his mouth and is vomiting after playing in the garage. What happened? Option A. He inhaled gas fumes. Option B. He ate a caustic cleaning chemical. Option C. He ate construction chalk. Option D. He has lead poisoning. The correct answer is option B. He ate a caustic cleaning chemical. Strong chemicals like drain cleaner or bleach cause immediate burns and ulcers on the mouth and throat. Question 45. Why is a child with a kidney problem weighed every day? Option A. To see if they are eating enough. Option B. To check the accuracy of their drink record. Option C. To show the child the importance of food. Option D. To see if their swelling or edema is getting better or worse. The correct answer is option D. To see if their swelling or edema is getting better or worse. Rapid changes in weight are the best way to track how much fluid the child's body is holding on to. Question 46. What should a nurse tell parents who are worried about their child losing their hair from radiation? Option A. It is an unavoidable part of treatment. Option B. There are many wig makers. Option C. Most children just wear a hat. Option D. The hair will grow back in a few months. The correct answer is option D. The hair will grow back in a few months. Knowing the hair loss is temporary provides the most comfort to families during a difficult time. Question 47. What is the best way to handle a child with leukemia who will not eat? Option A. Reward any attempt the child makes to eat. Option B. Force the child to gain weight. Option C. Try to make the child feel hungrier. Option D. Make mealtimes more pleasant. The correct answer is option A. Reward any attempt the child makes to eat. Positive reinforcement for even small amounts of food is the most successful way to improve intake. Question 48. What is an alternative to toothbrushing for a child taking phenytoin whose gums are sensitive? Option A. Use a water pick. Option B. Rinse with plain water. Option C. Rinse with hydrogen peroxide. Option D. Rinse with baking soda. The correct answer is option A. Use a water pick. A water pick provides a gentle way to clean the teeth and stimulate the gums without the pain of a brush. Question 49. How can a nurse help the siblings of a terminally ill child cope with their feelings? Option A. Open discussion only. Option B. Role-playing and acting out their feelings. Option C. Telling them stories. Option D. Having them draw pictures. The correct answer is option B. Role-playing and acting out their feelings. Role-playing allows children to express complex emotions in a safe and active way. Question 50. How can parents help a child with rheumatic fever who has painful joints? Option A. Have the child move all joints twice a day. Option B. Massage the joints with lotion. Option C. Keep the joints still and supported with pillows. Option D. Use a hot water bottle on the joints. The correct answer is option C. Keep the joints still and supported with pillows. Immobilizing the painful joints is the best way to provide comfort and allow them to heal. Question 51. What is the initial focus of care for a child with rheumatic fever? Option A. Maintaining contact with parents. Option B. Providing physical and psychological rest. Option C. Providing a high-calorie diet. Option D. Keeping the child interested in school. The correct answer is option B. Providing physical and psychological rest. Rest is the most critical part of recovery during the acute phase of the illness. Question 52. What is a toxic symptom of the medicine used for rheumatic fever? Option A. Ringing in the ears and nausea. Option B. A skin rash and blurry vision. Option C. Passing out and a sweet smell on the breath. Option D. Chills and a fever. The correct answer is option A. Ringing in the ears and nausea. Tinnitus or ringing in the ears is a classic sign that the dose of salicylate is too high. Question 53. Will a child with rheumatic fever always have arthritis? Option A. The pain usually goes away in less than 3 weeks. Option B. Aspirin will cure the arthritis. Option C. Motrin is the best drug for it. Option D. The pain goes away in 3 days. The correct answer is option A. The pain usually goes away in less than 3 weeks. While the joints are very painful during the illness, the condition does not usually cause permanent arthritis. Question 54. What should a mother do first if her child swallows a cleaning chemical? Option A. Give vinegar or lemon juice or orange juice. Option B. Call the doctor. Option C. Take the child to the emergency room. Option D, make the child vomit. The correct answer is option A, give vinegar or lemon juice or orange juice. The goal is to neutralize the chemical immediately before it causes more burns to the throat. Question 55. What is the most important goal for a child who had an accidental overdose? Option A, determine the child's activity pattern. Option B, reduce the mother's guilt. Option C, teach the parents how to use Ipecac. Option D, teach the parents how to keep the home safe. The correct answer is option D, teach the parents how to keep the home safe. Preventing future accidents through education and safety measures is the primary long-term goal. Question 56. A mother is worried because her 4-year-old has an imaginary friend. What should the nurse say? Option A, I will refer you to a specialist. Option B, try not to worry or you will upset the child. Option C, just ignore it and it will go away by age 8. Option D, this is normal behavior for a preschooler. The correct answer is option D, this is normal behavior for a preschooler. Imaginary friends are a common and healthy part of creative play for young children. Question 57. Why is propping a bottle dangerous for an infant besides the risk of choking? Option A, it causes asthma. Option B, it leads to ear infections. Option C, it causes eye infections. Option D, it causes a sore throat. The correct answer is option B, it leads to ear infections. Formula can pool in the back of the throat and travel into the ear tubes, causing an infection. Question 58. What is a symptom of Turner syndrome in a young girl? Option A, tall stature. Option B, no menstrual periods. Option C, early development of breasts. Option D, growth of breasts in boys. The correct answer is option B, no menstrual periods. This genetic condition often prevents normal puberty and menstruation. Question 59. What are early signs of an asthma attack in a toddler? Option A, fever and a runny nose. Option B, moodiness and fatigue and changes in breathing. Option C, dark circles under the eyes and glassy eyes. Option D, coughing and wheezing. The correct answer is option C, dark circles under the eyes and glassy eyes. Small changes in behavior and appearance often happen before the major breathing problems start. Question 60. What does it mean if a 3-year-old has a limp where one hip slants downward? Option A, she has scoliosis. Option B, she has a dislocated hip. Option C, she has a broken leg. Option D, she has a broken pelvis. The correct answer is option B, she has a dislocated hip. This specific type of limp is a classic sign that the hip joint is not in the correct place. Question 61. What is the most accurate way to monitor fluid balance in a child? Option A, weigh the child twice a day on the same scale. Option B, monitor how much they drink and urinate. Option C, check the concentration of the urine. Option D, look for swelling in the legs. The correct answer is option A, weigh the child twice a day on the same scale. Changes in body weight are the fastest and most reliable indicator of fluid gain or loss. Question 62. Which behavior by a parent indicates they are not coping well with their child's illness? Option A, talking to the nurses. Option B, talking to other family members. Option C, asking a minister for help. Option D, refusing to help care for the child. The correct answer is option D, refusing to help care for the child. Parents who are overwhelmed often withdraw, and it is important for the nurse to help them get involved. Question 63. What is a critical intervention for a baby after a cleft palate surgery? Option A, lay the baby on their stomach. Option B, keep the baby in arm restraints so they do not touch their mouth. Option C, clean the mouth once a day. Option D, give the baby a pacifier to keep them calm. The correct answer is option B, keep the baby in arm restraints so they do not touch their mouth. Restraints are necessary to prevent the infant from accidentally pulling at the stitches and causing a scar. Question 64. Which nursing diagnosis is the priority for a baby with a heart defect who is not growing well? Option A, altered nutrition. Option B, altered growth. Option C, activity intolerance. Option D, decreased cardiac output. The correct answer is option D, decreased cardiac output. The main problem is that the heart is not pumping well enough to provide oxygen and energy for the body to grow. Question 65. A child was burned in a gasoline explosion. What is the highest priority for the first 2 days? Option A, pain management. Option B, preventing infection. Option C, fluid replacement. Option D, monitoring for a blocked airway. The correct answer is option D, monitoring for a blocked airway. Burns to the face and neck often cause the throat to swell shut, so the nurse must ensure the child can breathe. Question 66. What should a nurse do first when a mother asks about her baby's clubfoot? Option A, call the bone specialist. Option B, ask the mother what the pediatrician has already told her. Option C, tell her it is not a serious problem. Option D, explain the different treatments. The correct answer is option B, ask the mother what the pediatrician has already told her. The nurse must first find out what the mother already knows before giving more information. Question 67. How is cystic fibrosis passed from parents to children? Option A, mothers pass it to their sons. Option B, fathers pass it to their daughters. Option C, both parents must have the disease. Option D, both parents must carry the gene. The correct answer is option D, both parents must carry the gene. This is a recessive trait, which means a child only gets it if both parents are carriers. Question 68. What is the main function of insulin in the body? Option A, it moves sugar into the cells and stores it in the liver. Option B, it breaks down sugar for energy. Option C, it causes high blood sugar. Option D, it breaks down proteins. The correct answer is option A, it moves sugar into the cells and stores it in the liver. Insulin acts like a key that opens the cells so they can receive the sugar they need for fuel. Question 69. When is a diabetic teenager at the highest risk for low blood sugar if he takes his shots at 7 in the morning? Option A, at 9 in the morning. Option B, at 1 in the afternoon. Option C, at 11 in the morning. Option D, at 3 in the afternoon. The correct answer is option C, at 11 in the morning. This is the time when the short-acting insulin is at its strongest and the child has not yet eaten lunch. Question 70. What should a diabetic cheerleader do before a 3-hour practice? Option A, ask the doctor for more insulin. Option B, increase her insulin dose by 1 unit for every hour. Option C, do nothing because exercise does not matter. Option D, eat a snack before practice to provide energy. The correct answer is option D, eat a snack before practice to provide energy. Exercise naturally lowers blood sugar, so the body needs extra food rather than extra insulin. Question 71. Which of the following is a short-acting insulin? Option A, Novolin Regular. Option B, Humulin NPH. Option C, Lente Beef. Option D, Protamine Zinc Insulin. The correct answer is option A, Novolin Regular. Regular insulin is the type used when a fast effect is needed. Question 72. Which type of insulin is clear and can be given through an intravenous line? Option A, NPH. Option B, pork insulin. Option C, regular. Option D, long-acting. The correct answer is option C, regular. Regular insulin is the only kind that is safe to put directly into the bloodstream. Question 73. Which tests are essential before a client starts taking lithium? Option A, blood count and hemoglobin. Option B, kidney function tests like blood urea nitrogen and creatinine. Option C, blood sugar and glucose tolerance. Option D, X-rays and heart tests. The correct answer is option B, kidney function tests like blood urea nitrogen and creatinine. Lithium is cleared through the kidney, so the doctor must make sure they are working perfectly to avoid poisoning. Question 74. A client's lithium level is 1.0. What should the nurse do? Option A, call the doctor immediately. Option B, hold the morning dose. Option C, give the medicine as scheduled. Option D, give a different medication instead. The correct answer is option C, give the medicine as scheduled. A level of 1.0 is perfectly normal and within the safe therapeutic range. Question 75. What is the first goal for a client who arrives at a rehab center for alcohol abuse? Option A, work on their self-image. Option B, fix their relationships. Option C, improve their coping skills. Option D, stabilize their physical health. The correct answer is option D, stabilize their physical health. The priority is to manage the dangerous symptoms of withdrawal and fix any vitamin or fluid problems. Question 76. A client says his drinking is not his fault because his father was also an alcoholic. What is the best response? Option A, that might be true, tell me more. Option B. Risk factors can often be controlled by taking responsibility. Option C. It sounds like you are making excuses. Option D. Were your father and grandfather both alcoholics? The correct answer is option B. Risk factors can often be controlled by taking responsibility. The nurse should acknowledge the genetic link but focus on the client's power to make healthy changes now. Question 77. What is an appropriate intervention for a teenager with anorexia who is in a behavior program? Option A. Set up routine tasks and activities around meal times. Option B. Give her lithium. Option C. Force her to eat more at every meal. Option D. Check her room every 10 minutes. The correct answer is option A. Set up routine tasks and activities around meal times. Routine and structure provide a sense of safety and help the client feel more in control of their environment. Question 78. How can a nurse measure if a teenager with anorexia is getting better? Option A. She says she accepts her body. Option B. She can verbalize realistic feelings about her body. Option C. She has a better perception of herself. Option D. She has more self-esteem. The correct answer is option B. She can verbalize realistic feelings about her body. The nurse needs to hear the client state specific and realistic facts about her body to measure progress. Question 79. A client who cuts her wrist says the nurses do not care about people. This is an example of option A. Reaction formation. Option B. Rationalization. Option C. Splitting. Option D. Sublimation. The correct answer is option C. Splitting. Splitting is a defense mechanism where the person sees everything and everyone as either all good or all bad. Question 80. What is the best response to a client who says nobody cares about the people here? Option A. How can you say that we just met? Option B. What makes you think that? Option C. You will feel differently in a few days. Option D. You seem angry, tell me more about how you feel. The correct answer is option D. You seem angry, tell me more about how you feel. Acknowledge the client's emotions and invite them to talk rather than being defensive. Question 81. Which medications are given to a client during electroconvulsive therapy? Option A. Antipsychotics and lithium. Option B. Atropine and an anesthetic and a muscle relaxant. Option C. Sodium and potassium and magnesium. Option D. Carbamazepine and Haldol. The correct answer is option B. Atropine and an anesthetic and a muscle relaxant. These drugs are used to dry up secretions and ensure the client is asleep and their muscles are relaxed during the procedure. Question 82. What must a client on a monoamine oxidase inhibitor restrict in their diet? Option A. Potassium. Option B. Tryptophan. Option C. Tyramine. Option D. Saturated fats. The correct answer is option C. Tyramine. Tyramine found in many common foods can cause a dangerous and sudden rise in blood pressure. Question 83. What is the most life-threatening side effect of a monoamine oxidase inhibitor? Option A. An eye crisis. Option B. A hypertensive crisis. Option C. A sudden drop in blood pressure. Option D. Involuntary muscle movements. The correct answer is option B. A hypertensive crisis. If the client eats the wrong foods, their blood pressure can reach a level that causes a stroke or heart attack. Question 84. A client taking haloperidol says she cannot stay still and tosses and turns all night. What is this? Option A. Akathisia. Option B. Akinesia. Option C. Dystonia. Option D. Opisthotonos. The correct answer is option A. Akathisia. Akathisia is a common side effect of antipsychotics that feels like an intense inner restlessness. Question 85. What might a nurse suggest to a client whose medicine is making her feel restless at night? Option A. Double the dose of the other medicine. Option B. Decrease the dose of the antipsychotic. Option C. Take the anti-restlessness medicine in the morning instead of at night. Option D. Take the medicine with milk. The correct answer is option C. Take the anti-restlessness medicine in the morning instead of at night. Changing the timing of the dose can help the client sleep better while still getting the benefits of the drug. Question 86. What part of a mental status exam is a good indicator of suicide risk? Option A. The client's insight. Option B. The client's thought process. Option C. The client's mood and affect. Option D. The client's ability to think abstractly. The correct answer is option C. The client's mood and affect. A sudden improvement in mood can often mean the person has finally made a plan to end their life and feels relieved. Question 87. Why are children more likely to get lung infections than adults? Option A. They have fewer air sacs and breathe slower. Option B. They breathe with their diaphragms and use more air. Option C. They have more air sacs and breathe with their diaphragms. Option D. Their chests are rounded and they exchange a smaller volume of air. The correct answer is option D. Their chests are rounded and they exchange a smaller volume of air. The shape of a child's chest and the smaller amount of air they move makes it easier for germs to settle in. Question 88. What is a classic sign of epiglottitis in a 2-year-old? Option A. A productive cough. Option B. Noises when they breathe out. Option C. Drooling. Option D. Noises in the bottom of the lungs. The correct answer is option C. Drooling. Because the throat is swollen shut, the child cannot swallow their own saliva. Question 89. What is the highest priority goal for a child with a severe throat infection? Option A. Resting and lying quietly for 10 hours a day. Option B. Eating foods from all food groups. Option C. Having no fever. Option D. Playing for 4 hours a day. The correct answer is option A. Resting and lying quietly for 10 hours a day. Keeping the child calm and rested reduces their need for oxygen and prevents the airway from closing further. Question 90. What should be at the bedside of any child with epiglottitis? Option A. A heart monitor. Option B. A tracheostomy set for an emergency surgery. Option C. An intake and output chart. Option D. A scale for weighing. The correct answer is option B. A tracheostomy set for an emergency surgery. If the child's airway closes completely, the doctor must be able to perform an emergency surgery immediately. Question 91. What does a pulse oximeter measure? Option A. The amount of oxygen in the whole blood. Option B. The oxygen saturation of the arterial blood. Option C. The pressure of the oxygen. Option D. The affinity of hemoglobin. The correct answer is option B. The oxygen saturation of the arterial blood. This non-invasive tool shows how much oxygen the blood cells are carrying to the body. Question 92. What must a nurse do by law if they suspect a child is being abused? Option A. Tell the physician. Option B. Report the suspicion to the authorities. Option C. Talk to the father. Option D. Confront the mother. The correct answer is option B. Report the suspicion to the authorities. Healthcare workers are legally required to report any suspected child abuse to the government. Question 93. A mother says her preschooler tells lies. What should the nurse know? Option A. This is not normal. Option B. The mother is lying. Option C. Storytelling is a normal part of separating fantasy from reality. Option D. The child is delayed. The correct answer is option C. Storytelling is a normal part of separating fantasy from reality. Young children often make up stories as their imaginations develop, and it is not considered the same as adult lying. Question 94. How do we know if a family has been successfully treated for child abuse? Option A. The child is moved to a foster home. Option B. The parents say the child is different. Option C. The father is arrested. Option D. The parents know what is normal behavior for their child's age. The correct answer is option D. The parents know what is normal behavior for their child's age. Abuse often happens because parents do not understand what a child is capable of doing at a certain age. Question 95. What are early signs of septic shock in a child? Option A. Fever and a fast heart rate and fast breathing. Option B. Cold skin and blue hands. Option C. High blood pressure and a weak pulse. Option D. Normal pulse and low blood pressure. The correct answer is option A. Fever and a fast heart rate and fast breathing. A high fever and rapid heart and breathing rates are the first clues that a child has a severe infection. Question 96. What is the first sign of a blood infection in a burn child? Option A. Disorientation and confusion. Option B. A low fever. Option C. Diarrhea. Option D. High blood pressure. The correct answer is option A. Disorientation and confusion. Changes in the child's mental state are often the very first sign that a dangerous infection is starting. Question 97. What is the best way to see if a burn child is getting enough fluids? Option A. Checking the blood pressure. Option B. Checking their level of consciousness and mental state. Option C. Checking their skin turgor. Option D. Checking how much they drink. The correct answer is option B, checking their level of consciousness and mental state. If the brain is receiving enough blood to keep the child alert, it is a good sign that the fluid replacement is working. Question 98. What is the correct diet for a child with celiac disease? Option A, no milk products. Option B, no gluten. Option C, no phenylalanine. Option D, no fat. The correct answer is option B, no gluten. Children with this disease cannot process the proteins found in wheat and barley and rye. Question 99. Which finding is expected when assessing an 80-year-old with poor leg circulation? Option A, the legs are warm with a strong pulse. Option B, the legs turn blue when hanging down. Option C, a decreased or absent pulse in the leg with pain. Option D, the painful leg is warmer than the other. The correct answer is option C, a decreased or absent pulse in the leg with pain. Arterial disease prevents blood from reaching the foot, making it cold and the pulse hard to find. Question 100. What should a nurse check before a client has an angiography of the leg? Option A, allergy to iodine or shellfish. Option B, if the client can do leg exercises. Option C, if the client has eaten in the last 4 hours. Option D, if the vital signs are normal. The correct answer is option A, allergy to iodine or shellfish. The procedure uses a dye that contains iodine, which can cause a severe allergic reaction. Question 101. How does the medication warfarin work? Option A, it dissolves clots that are already there. Option B, it prevents the blood from clumping together. Option C, it interferes with vitamin K to stop new clots from forming. Option D, it makes more platelets. The correct answer is option C, it interferes with vitamin K to stop new clots from forming. Warfarin slows down the body's ability to make the chemicals needed to form a blood clot. Question 102. What should a nurse tell a client who is going home on warfarin? Option A, double your dose if you forget one. Option B, take aspirin for headaches. Option C, carry a medical alert card at all times. Option D, use a regular straight razor to shave. The correct answer is option C, carry a medical alert card at all times. It is vital that any doctor or emergency worker knows the person is taking a blood thinner. Question 103. What causes the chest pain in a person having a heart attack? Option A, the body is making too much acid because of a lack of oxygen. Option B, there is too much blood in the heart. Option C, the nervous system is too calm. Option D, the heart is making too many chemicals because of anxiety. The correct answer is option A, the body is making too much acid because of a lack of oxygen. When the heart muscle does not get enough oxygen, it produces lactic acid, which causes intense pain. Question 104. How does morphine help a person having a heart attack? Option A, it makes them more alert. Option B, it makes them breathe faster. Option C, it opens up the blood vessels to reduce the work of the heart. Option D, it makes the pain feel sharper. The correct answer is option C, it opens up the blood vessels to reduce the work of the heart. Morphine reduces the workload on the heart by relaxing the blood vessels throughout the body. Question 105. What should a nurse do immediately after a client returns from a heart catheterization? Option A, keep the client from eating for 4 hours. Option B, check the site where the tube went in every 15 minutes. Option C, put the head of the bed all the way up. Option D, have the client walk to the bathroom. The correct answer is option B, check the site where the tube went in every 15 minutes. The nurse must watch for any internal or external bleeding from the artery that was used. Question 106. Which test is monitored to see if a client has a reaction to the water pill furosemide? Option A, serum electrolytes. Option B, blood gases. Option C, a full blood count. Option D, a 12-lead heart monitor. The correct answer is option A, serum electrolytes. This medication can cause the body to lose too much potassium, which is dangerous for the heart. Question 107. Which statement by a client shows they understand their digoxin medication? Option A, I will call the doctor if I feel sick to my stomach or see double. Option B, I can stop taking it when I feel better. Option C, I will only take it if my heart is beating very fast. Option D, I should always take it with an antacid. The correct answer is option A, I will call the doctor if I feel sick to my stomach or see double. Nausea and vision changes are common early signs that the level of digoxin in the blood is too high. Question 108. What does the rash from systemic lupus erythematosus look like? Option A, small reddish-brown spots all over. Option B, clusters of blisters. Option C, redness on the palms of the hands. Option D, a red butterfly-shaped rash over the cheeks and nose. The correct answer is option D, a red butterfly-shaped rash over the cheeks and nose. This classic skin sign is one of the primary ways the disease is identified. Question 109. Which blood test result would a nurse expect in a client with lupus who bruises easily? Option A, a low number of platelets. Option B, a high white cell count. Option C, a high hemoglobin. Option D, a high number of lymphocytes. The correct answer is option A, a low number of platelets. Platelets are needed for clotting, and lupus can cause the body to destroy its own platelets. Question 110. Which instruction is correct for a client taking prednisone? Option A, drink 4 liters of water a day. Option B, avoid people who have a cold or the flu. Option C, use a firm toothbrush. Option D, stop the medicine if you feel sad. The correct answer is option B, avoid people who have a cold or the flu. Prednisone weakens the immune system, making it much easier for the client to get sick. Question 111. Why does a person with liver disease have itchy skin? Option A, because they are not washing enough. Option B, because their body is not processing bilirubin correctly. Option C, because they are taking too many drugs. Option D, because of the blood flow in their abdomen. The correct answer is option B, because their body is not processing bilirubin correctly. When the liver fails, bile salts build up in the skin and cause intense itching. Question 112. Which food is a good bedtime snack for a person with liver failure and high ammonia? Option A, fresh fruit. Option B, a milkshake. Option C, crackers and peanut butter. Option D, a ham and cheese sandwich. The correct answer is option A, fresh fruit. Fruit is low in protein, which is necessary to keep the ammonia levels from rising in the brain. Question 113. What is a sign that an intravenous infusion of albumin is working for a client with liver disease? Option A, the heart rate slows down. Option B, the urine output increases. Option C, the lungs sound clear. Option D, the client has a fever. The correct answer is option B, the urine output increases. Albumin pulls fluid out of the tissues and back into the blood, where it can be filtered out by the kidneys. Question 114. Why is a comatose client with liver failure given neomycin through a tube? Option A, to stop a general infection. Option B, to help them urinate. Option C, to lower the amount of ammonia their body makes. Option D, to make the intestines more acidic. The correct answer is option C, to lower the amount of ammonia their body makes. Neomycin kills the bacteria that turn protein into ammonia, preventing the brain from being poisoned further. Question 115. Why is a person with liver failure at a high risk for bleeding? Option A, they are absorbing too much vitamin K. Option B, they have a low number of platelets because of an enlarged spleen. Option C, their liver cells are working too hard. Option D, they are making too many clotting factors. The correct answer is option B, they have a low number of platelets because of an enlarged spleen. An enlarged spleen can trap and destroy platelets, making it hard for the blood to clot. Question 116. How would a nurse interpret a pH of 7.3 and a carbon dioxide of 51 and a bicarbonate of 18? Option A, compensated metabolic alkalosis. Option B, respiratory acidosis. Option C, partially compensated alkalosis. Option D, combined respiratory and metabolic acidosis. The correct answer is option D, combined respiratory and metabolic acidosis. Both the lungs and the kidneys are failing to keep the body's acid levels in balance. Question 117. Why does a doctor give sugar and insulin intravenously to a person with high potassium? Option A, to remove it through the kidneys. Option B, to protect the heart from a low level. Option C, to stop the body from breaking down protein. Option D, to push the potassium out of the blood and back into the cells. The correct answer is option D, to push the potassium out of the blood and back into the cells. This is a fast way to lower the potassium level in the blood to prevent the heart from stopping. Question 118. Why does a person with kidney failure have trouble with oxygen and gas exchange? Option A, they are making fewer red blood cells. Option B, they have too much vitamin D. Option C, they are making too many red blood cells. Option D, they are not making enough renin. The correct answer is option A, they are making fewer red blood cells. The kidneys make a hormone that helps create red blood cells, and without it the blood cannot carry enough oxygen. Question 119. What should a nurse do for a child whose lungs have partially collapsed after surgery? Option A, let the child stay in whatever position is comfortable. Option B, give more pain medicine. Option C, have the child turn and cough and breathe deeply every 2 hours. Option D, keep the room as quiet as possible. The correct answer is option C, have the child turn and cough and breathe deeply every 2 hours. Active breathing exercises are the only way to get the lungs to fully open up again. Question 120. Why is saline used instead of water to rinse a stomach tube? Option A, water will wash away the body's electrolytes. Option B, saline reduces stomach pain. Option C, water makes the client restless. Option D, saline makes the bowels move faster. The correct answer is option A, water will wash away the body's electrolytes. Using plain water can cause the body to lose vital salts and lead to a dangerous chemical imbalance. Question 121. When should a nurse report a postoperative client's inability to urinate? Option A, if they have not gone in 4 hours. Option B, if they have not gone since lunch. Option C, if they have not gone within 8 hours of the surgery. Option D, only if the client is in pain. The correct answer is option C, if they have not gone within 8 hours of the surgery. The body should start producing and releasing urine shortly after surgery, and a long delay is a concern. Question 122. Why are antibiotics given to a client before they have colon surgery? Option A, to make the bowels move. Option B, to reduce the risk of infection from the bacteria that live in the gut. Option C, to make the client feel better. Option D, to stop a fever during the operation. The correct answer is option B, to reduce the risk of infection from the bacteria that live in the gut. The colon is full of germs, and giving medicine beforehand helps prevent those germs from causing an infection during the procedure. Question 123. What must a nurse do before giving digoxin to a toddler? Option A, make sure the pulse is not 60. Option B, make sure the pulse is exactly 100. Option C, take the heart rate with a stethoscope for a full minute. Option D, check the child's vision. The correct answer is option C, take the heart rate with a stethoscope for a full minute. The apical pulse is the most accurate way to check the heart rate and must be counted for 60 seconds. Question 124. What is the correct explanation for a patent ductus arteriosus repair? Option A, it is an open heart surgery using a heart-lung machine. Option B, it is a closed heart surgery that does not use a machine. Option C, it is just like a bypass surgery for adults. Option D, it is an invasive procedure to open up a narrowed vessel. The correct answer is option B, it is a closed heart surgery that does not use a machine. The surgery involves tying off a blood vessel that did not close on its own, and it is not performed inside the heart itself. Question 125. A child needs a dose of atropine 0.15 mg. The bottle has 0.4 mg per milliliter. How much should the nurse give? Option A, 0.06 milliliters. Option B, 0.38 milliliters. Option C, 2.7 milliliters. Option D, not enough information. The correct answer is option B, 0.38 milliliters. The nurse should divide 0.15 by 0.4 to get the correct volume. Question 126. What is the very first thing a nurse does when a client arrives in the recovery room? Option A, check the heart rate and blood pressure. Option B, ask the client how they feel. Option C, review the doctor's orders. Option D, check the airway and how well the client is breathing. The correct answer is option D, check the airway and how well the client is breathing. Ensuring the client can breathe and is getting enough oxygen is always the most important first step. Question 127. Why is a client given the drug dantrolene before a tonsillectomy? Option A, to stop a future infection. Option B, to prevent a dangerous high fever reaction to anesthesia. Option C, to stop muscle pain after surgery. Option D, to prevent a normal fever. The correct answer is option B, to prevent a dangerous high fever reaction to anesthesia. Some people have a genetic risk for a fatal reaction to anesthesia called malignant hyperthermia, and this drug prevents it. Question 128. A client has a rigid belly and a high fever 3 days after gallbladder surgery. What is likely happening? Option A. They have a stomach ache. Option B. The incision has opened up. Option C. They have an infection in the abdominal lining called peritonitis. Option D. They have a blood clot in the lung. The correct answer is option C. They have an infection in the abdominal lining called peritonitis. If an organ leaks into the abdomen, it causes a severe and life-threatening infection. Question 129. What is balanced anesthesia? Option A. A type of regional numbing. Option B. Using equal parts gas and liquid. Option C. A way to keep the brain alert. Option D. A combination of several drugs to make the surgery smooth and safe. The correct answer is option D. A combination of several drugs to make the surgery smooth and safe. Doctors use a mix of medications to keep the client asleep and pain-free while minimizing side effects. Question 130. A woman awaiting surgery has chest tightness and is breathing very fast and deep. This is, option A, a heart attack. Option B, a bid for attention. Option C, a blocked airway. Option D, hyperventilation caused by anxiety. The correct answer is option D, hyperventilation caused by anxiety. Extreme stress can cause a person to breathe too fast, which leads to physical symptoms that feel like a heart attack. Question 131. Which antibiotic is used to treat a serious infection called Pseudomonas? Option A, cefepid. Option B, Cleocin. Option C, Dacil. Option D, erythrocin. The correct answer is option A, cefepid. This specific drug is one of the few that is effective against this very tough type of bacteria. Question 132. When should a woman take her temperature to check for ovulation? Option A, every night at bedtime. Option B, once a day at any time. Option C, only when she feels warm. Option D, as soon as she wakes up before any activity. The correct answer is option D, as soon as she wakes up before any activity. To be accurate, the basal body temperature must be taken before the person even gets out of bed. Question 133. What is a helpful way to stop hyperventilation? Option A, give the client a high dose of Valium. Option B, make the room very warm. Option C, have the client breathe into a paper bag. Option D, try to distract the client with a movie. The correct answer is option C, have the client breathe into a paper bag. Breathing into a bag helps the person breathe back in their own carbon dioxide to fix the chemical balance in their blood. Question 134. What is the most helpful thing a nurse can do when a baby is stillborn? Option A, tell the parents they have an angel in heaven. Option B, tell them they should not see the baby. Option C, give them as much time as they need to see and hold the baby. Option D, tell them they can have another baby soon. The correct answer is option C, give them as much time as they need to see and hold the baby. Providing a safe space and time for the parents to bond with and say goodbye to their child is essential for their healing. Question 135. A non-stress test shows the baby's heart rate goes up by 20 beats for 20 seconds when it moves. This is, option A, an inconclusive test that must be repeated. Option B, a sign that more tests are needed. Option C, a normal and healthy reaction from the baby. Option D, a sign of fetal distress. The correct answer is option C, a normal and healthy reaction from the baby. These increases in heart rate show that the baby is healthy and reacting well to its own movement. Question 136. Which stage of labor starts when the baby is born and ends when the placenta comes out? Option A, stage 2. Option B, stage 3. Option C, stage 4. Option D, stage 5. The correct answer is option B, stage 3. This is the final active part of the delivery process where the afterbirth is expelled. Question 137. What type of discharge should a nurse expect from a woman who gave birth 3 days ago? Option A, dark red blood and small clots. Option B, thin brownish pink fluid. Option C, yellowish white fluid. Option D, a very small amount of clear fluid. The correct answer is option A, dark red blood and small clots. In the first few days after birth, the discharge is mostly blood and is called lochia rubra.